What is blood pressure? When the heart pumps blood through the arteries, the blood puts pressure on the artery walls. This is known as blood pressure. Blood pressure is the pressure of blood pushing against the walls of your arteries. Arteries carry blood from your heart to other parts of your body. Your blood pressure normally rises and falls throughout the day. What is high blood pressure or hypertension? Blood pumping through the circulatory system is under pressure, much like the water in the pipes of a house. And just as too much water pressure can damage pipes and faucets, elevated blood pressure can spell trouble. Hypertension occurs when the force exerted against artery walls is abnormally high. Over time, elevated pressure can cause a wide range of problems. Small bulges, called aneurysms, may form in blood vessels. The heart can become enlarged, increasing the danger of heart failure. Damage to blood vessels in the kidneys can cause them to fail. Tiny blood vessels in the eyes are vulnerable to damage. Hypertension can lead to vision problems and even blindness. What do blood pressure numbers mean? Blood pressure is measured using two numbers. The first number, called systolic blood pressure, measures the pressure in your arteries when your heart beats. The second number, called diastolic blood pressure, measures the pressure in your arteries when your heart rests between beats. If the measurement reads 120 systolic and 80 diastolic, you would say, 120/80, or write, 120/80ths of a millimeter of mercury. What are normal blood pressure numbers? A normal blood pressure level is less than 120/80ths of a millimeter of mercury. What is high blood pressure, hypertension? High blood pressure, also called hypertension, is blood pressure that is higher than normal. Your blood pressure changes throughout the day based on your activities. Having blood pressure measures consistently above normal may result in a diagnosis of high blood pressure or hypertension. What is essential hypertension? In as many as 95% of reported high blood pressure cases in the U.S., the underlying cause can't be determined. This is essential hypertension. High blood pressure. High blood pressure tends to run in families. Age and race also play a role. Diet and lifestyle also play a big role in essential hypertension. The link between salt and high blood pressure is especially noteworthy. Many people with high blood pressure are salt sensitive. That means anything more a minimal amount will raise their blood pressure. Other things associated with essential hypertension include obesity, diabetes, stress, low levels of potassium, calcium, and magnesium, lack of physical activity, heavy alcohol use. What is secondary hypertension? When a direct cause for high blood pressure can be identified, that's secondary hypertension. Kidney disease is the most common cause. Tumors or conditions that cause the adrenal glands to release large amounts of hormones can raise blood pressure. Renal artery stenosis. Renal artery stenosis is a narrowing of arteries that carry blood to one or both of the kidneys. It is most often seen in older people with atherosclerosis, hardening of the arteries. Renal artery stenosis can worsen over time and often leads to hypertension, high blood pressure, and kidney damage. The body senses less blood reaching the kidneys and misinterprets that as the body having low blood pressure. This signals the release of hormones from the kidney that lead to an increase in blood pressure. Over time, renal artery stenosis can lead to kidney failure. Birth control pills, specifically those that have estrogen, and pregnancy can boost blood pressure. If you have high blood pressure to begin with, it can rise to dangerous levels. Some medications may interact with your blood pressure medicine. This can prevent either drug from working properly. Here are common types of drugs that can make your high blood pressure worse. Nonsteroidal anti-inflammatory drugs, NSAIDs. NSAIDs include both prescription and over-the-counter medication. They are often used to relieve pain or reduce inflammation from conditions such as arthritis or for pain relief. However, NSAIDs can make your body retain fluid and decrease the function of your kidneys. NSAIDs and kidneys. This may cause your blood pressure to rise even higher, putting greater stress on your heart and kidneys. NSAIDs can also raise your risk for heart attack or stroke, especially in higher doses. Common NSAIDs that can raise blood pressure include ibuprofen, Advil, Motrin, and naproxen, Aleve, naproxen. You may also find NSAIDs and over-the-counter medication for other health problems. Cold medicine, for example, often contains NSAIDs. It's a good idea whenever you purchase an over-the-counter drug to check the label for NSAIDs. Ask your doctor if any NSAID is okay for you to use. Your doctor may be able to recommend alternatives, such as using acetaminophen instead of ibuprofen. Cough and cold medications also frequently contain decongestants. Decongestants can make blood pressure worse in two ways. Decongestants may make your blood pressure and heart rate rise. Decongestants may prevent your blood pressure medication from working properly. Pseudoephedrine, Sudafed, is a specific decongestant that can increase blood pressure. What can you do? Avoid using cough and cold medicine that contains NSAIDs or decongestants, especially pseudoephedrine. Ask your doctor for suggestions about other ways to ease congestion symptoms, such as antihistamines or nasal sprays. Migraine headache medications. Some migraine medications work by tightening blood vessels in your head. This relieves migraine pain. However, they also constrict blood vessels throughout your body. This makes your blood pressure rise, perhaps to dangerous levels. If you have high blood pressure or any other type of heart disease, talk with your doctor before taking a drug for migraines or severe headaches. Weight loss drugs. Some weight loss drugs may make heart disease worse. Appetite suppressants tend to rev up your body. This can make blood pressure rise and put more stress on your heart. Before using any weight loss drug, whether prescription or over-the-counter, be sure to check with your doctor. These medications can be useful for weight loss, but may do more harm than good. What is prehypertension? In stage 1 hypertension, also known as prehypertension, the systolic, top number, reading is 120 mm of mercury to 139 mm of mercury. The diastolic, bottom number, reading is 80 mm of mercury to 89 mm of mercury. Prehypertension. Prehypertension is a warning sign that you may get high blood pressure in the future. High blood pressure increases your risk of heart attack, stroke, coronary heart disease, heart failure, and kidney failure. There's no cure for high blood pressure, but there is treatment with diet, lifestyle habits, and medications. Starting as low as 115/75 of a millimeter of mercury, the risk of heart attack and stroke doubles for every 20-point jump in systolic blood pressure. It doubles for every 10-point rise in diastolic blood pressure for adults aged 40 to 70. Who is at risk for prehypertension? Nearly half of all adults older than age 18 have prehypertension or hypertension, as measured by average of 2 or more readings at 2 or more doctor's visits. People with prehypertension may have a greater risk for other cardiovascular disease, CVD, risk factors. High cholesterol, obesity, and diabetes are seen more in people with prehypertension than in those with normal blood pressure. Is prehypertension a result of aging? You may wonder if high blood pressure happens with aging, but experts do not agree with it. Some populations across the globe have minimal rise in blood pressure with aging. In some parts of Mexico, the South Pacific, and other parts of the world, people have very low salt intake. In these areas, the age-related rise in blood pressure is small compared with the US. Is there a treatment for prehypertension? Prehypertension is a warning sign. It means that you're at a greater risk of high blood pressure. Depending on your blood pressure and risk factors for heart disease, you may only need to make a few lifestyle adjustments. Here are some strategies to help you manage prehypertension. Lose weight if you are overweight. Being overweight increases the risk of high blood pressure. However, losing weight can lower high blood pressure. Modest weight loss can prevent hypertension by 20% in overweight people with prehypertension. Exercise regularly. Exercise helps you lose weight. Exercise also helps lower blood pressure. Eat plenty of fruits, vegetables, whole grains, fish, and low-fat dairy. Studies show high blood pressure can be lowered and prevented with a DASH diet. This DASH diet is low in sodium and high in potassium, magnesium, calcium, protein, and fiber. Cut back on dietary salt/sodium. A diet high in sodium, salt, can increase blood pressure. A low-sodium diet can lower high blood pressure or prevent it. Aim for less than 2,300 mg of sodium daily, about 1 teaspoon of table salt. Eat foods low in saturated and trans fat and cholesterol. Saturated fat, trans fat. Diets high in saturated fat, meats and high-fat dairy, trans fat, some margarine, snack foods, and pastries. And cholesterol, organ meats, high-fat dairy, and egg yolks, may lead to obesity, heart disease, and cancer. Eat a plant-based or vegetarian diet. Add high-protein soy foods to your diet. Increase servings of fruits and vegetables by adding 1 serving at a time. You can add a serving of fruit at lunchtime. Then add a serving of vegetables at dinner. Drink only in moderation. Drinking excess alcohol can increase blood pressure. Limit drinking to no more than 2 drinks a day for men and 1 drink a day for women. It's important to get your blood pressure checked regularly. Know your blood pressure number. Let your doctor know if your blood pressure number is higher. You can monitor your blood pressure between doctor's visits with a home blood pressure monitor. Or, you can use an electronic blood pressure monitor at your local pharmacy, grocery store, or fire station. When a person gets a blood pressure reading, they will have one of the following. Normal, less than 120/80ths of a millimeter Hg. Elevated, 120 to 129/80ths of a millimeter Hg. At this stage, a doctor will advise the individual to make lifestyle changes to return their blood pressure to the normal range. Stage 1 hypertension, 130 to 139/80 to 89 mm Hg. Stage 2 hypertension, over 140/90ths of a millimeter Hg. Hypertensive crisis, 180/120ths of a millimeter Hg or above. A person with a hypertensive crisis needs immediate medical attention. What are the signs and symptoms of high blood pressure? High blood pressure usually has no warning signs or symptoms, and many people do not know they have it. Measuring your blood pressure is the only way to know whether you have high blood pressure. What affects a blood pressure reading? Many things can affect a blood pressure reading, including nervousness about having your blood pressure taken. This is called white coat syndrome. 1 in 3 people who have a high blood pressure reading at the doctor's office may have normal blood pressure readings outside of it. What you ate, drank, or did before your reading. If you smoked, drank alcohol or caffeine, or exercised within 30 minutes of having your blood pressure measured, your reading might be higher. How you are sitting. Crossing your legs and letting your arm droop at your side rather than rest on a table at chest height can make your blood pressure go up. Blood pressure reading. It's important to get an accurate blood pressure reading so that you have a clearer picture of your risk for heart disease and stroke. A reading that says your blood pressure is lower than it actually is may give you a false sense of security about your health. A reading that says your blood pressure is higher than it actually is may lead to treatment you don't need. The correct way to measure blood pressure. Don't eat or drink anything 30 minutes before you take your blood pressure. Empty your bladder before your reading. Sit in a comfortable chair with your back supported for at least 5 minutes before your reading. Put both feet flat on the ground and keep your legs uncrossed. Rest your arm with the cuff on a table at chest height. Make sure the blood pressure cuff is snug but not too tight. The cuff should be against your bare skin, not over clothing. Do not talk while your blood pressure is being measured. How do healthcare professionals measure my blood pressure? First, a healthcare professional wraps an inflatable cuff around your arm. The healthcare professional then inflates the cuff, which gently tightens on your arm. The cuff has a gauge on it that will measure your blood pressure. The healthcare professional will slowly let air out of the cuff while listening to your pulse with a stethoscope and watching the gauge. This process is quick and painless. If using a digital or automatic blood pressure cuff, the healthcare professional will not need to use a stethoscope. The gauge uses a unit of measurement called millimeters of mercury, mmHg, to measure the pressure in your blood vessels.